Welcome back to the program. I'm Chris McCutcheon. You're listening to Aging with Options, Louisville's radio program dedicated to seniors and topics of importance to our senior community. My guests in the studio today are April Abele and Eric Wint with Gentiva Home Health. We've been talking about Gentiva's balance and fall prevention program. It's called Safe Strides, and April and Eric have been sharing some very interesting and valuable information about this program. And April, you covered a couple of the components that you mentioned, 4 components that go into the assessment that you do to evaluate a patient's ability to stay balanced and to prevent falls. You covered a couple of those, but I know there's a couple others as well. Tell us about those.
Okay, well, one we as physical therapists really didn't do a lot with prior to this kind of an exam. It is very important. It's actually sensation. It's actually what input our skin and our joints kind of give us and that we need, that our brain needs to have the correct output, to put my foot in front or whatnot. When you go outside and you walk on the grass, particularly our elderly population, they'll stay away from the grass because it's bumpy, it's lumpy, and if you cannot feel underneath your feet well, then you don't know that your foot is going to be maybe turning to the right. And you need every second to make that adjustment to come back to the left, or you'll fall. So it's extraordinarily important for us actually to get in there and test the bottom of the feet, test if a person has sensation. It's somebody with diabetes, typically you think of a peripheral neuropathy where they can't feel their feet, but you would be amazed how many people we find that cannot feel big portions of their feet. Now, that's extraordinarily important. Certainly for safety's sake, because they could have something in their foot. I mean, good Lord, we found somebody with a toothpick.
Oh, my goodness.
Did not know.
Wow.
It happens. It happens. And really, typically, you don't know until you're tested. So at that point, I better be talking about education, putting the proper shoes on, making sure that lights are on, clearing the path. Seeing there are things that are extraordinarily important, but also for the balance component, to talk to them about that. So that's a very important component. And then the last component is really the ears. If you've ever had a vertigo, that sensation of spinning, almost like getting out of an amusement park ride, that spins around. Mm-hmm. Imagine that sensation every time you moved your head in a certain way. Mm. And an interesting story, actually, there's this lovely elderly woman that I saw. I walked in to do her physical therapy assessment into her home, and I noticed everything she owned was on countertops, was on tables. And I, as a physical therapist, typically doing a lot of orthopedics prior to this, I thought she had a backache or shoulder pain. She couldn't reach. That's what I thought. But no, every time she looked up or she looked down, she got dizzy and fell a lot of the times. Mm-hmm.
She's keeping things close.
Keeping things close to her. Yeah. And what I found after doing this evaluation was she had this inner ear dysfunction that created this vertigo with a head movement. So it made her very dizzy.
So how do you improve that then?
Well, it's actually very interesting and just a wonderful tool to have, because I will get her in certain positions, get the head in certain positions, and then I can evaluate where is the dysfunction in her ears. If I can figure that out, and if I can treat that, then I can make this issue so much better and hopefully alleviate it. So I did this test on her. Sure enough, she had a particular dysfunction in her ears. I was able to clear it in 3 visits. Oh, wow. I asked her how long she had this for. She said 20 years.
Oh, my goodness.
And I said, why didn't you tell the doctor? She said, because she thought it was just part of getting old.
Wow.
Which is so sad.
Wow.
Now, we cleared it in 3 visits. 3rd visit, we're putting all of her things away.
That's amazing.
It was incredible. And this happens. And the prevalence of this particular dysfunction is huge.
And that's a significant point, too, that, a lot of the senior population, they equate telling a healthcare provider, either us in the home or their physician, that they are falling. They have this fear of telling us that because they equate falling to maybe having to go to a nursing home or being taken out of their home environment. And in reality, it's just the opposite. By telling us those things early and not going 20 years, having this issue going on where every time you look in a certain direction, you get dizzy. Our job in home health is to work with the physicians to keep you where you want to be. If you're in your home, our job is to keep you in your home and fix all these problems so that you can do that safely.
Wow. So many folks may be reluctant to admit to these types of issues just because they don't want to see life change and their surroundings change and have to transition into a facility of some sort.
Absolutely.
Very interesting. So Safe Strides is the program we're talking about, and it's a balance improvement and fall prevention program. Talk to us a little bit, April and Eric, and you touched on it just a minute ago, April, but the falls is not a normal consequence of aging, right?
No.
Absolutely not.
It's not something to be expected just because you reach a certain age that now I'm going to start falling a whole lot. You've touched on that for a minute. Tell us about the incidence, the prevalence of falls, and why this is important. We touched on at the beginning that a third of the folks over the age of 65 are going to experience a fall this year. But give us a little bit of information around the prevalence of falls and why this is such a big deal.
Well, as you said, 1/3 of people over 65 will fall this year. A full over one half of people over 85 will fall this year. And those, as Eric was saying, are people who admit it. That's,
right.
that's, you don't want to admit that you fell to your children. It takes away that independence. But the important thing is, we got to know, because this sounds silly, but the biggest predictor of a fall is a previous fall. So we've got to get in there and we've got to stop that next fall, because maybe on that next fall, you hurt something, you break something, and that for sure is going to put you in the hospital in a rehab facility.
And there's a lot of significance to this stat when it comes to a third of our seniors 65 and older will fall this year, 85 and over, 50%. And again, a lot of people will equate falling to hip fractures and things like that. It's a very common injury from a fall. And a lot of people don't realize this, but, depend on the research that you read, anywhere from 25% to 35% probably of folks that are over the age of 65 fall, have a traumatic hip fracture, are dead within 1 year of their fall and their fracture.
Wow.
And again, it's not from the fracture. It's because, as a result of this fall and the fracture, now they become less mobile. And it's just the way the body works. Our bodies are meant to move. And when we stop moving, everything else just shuts down.
And I would imagine for a lot of folks, seniors in particular, once they've fallen, they become fearful of falling again, right? So they probably take certain precautions, maybe a little bit reluctant to do certain things because they've already experienced a fall.
Absolutely. And then the result of that, of course, is now they are moving less. They're challenging all these 4 systems of balance less. And all those 4 systems are just like our muscles. When we don't use our muscles, they atrophy and they get weaker. Same thing with your eyes, your inner ear, your proprioception, all those things that we've talked about today. When we don't use those and challenge those on a day-to-day basis, they start to get weak, and then you start to have even more problem.
Wow. Very interesting topic. So again, we're talking about the Safe Strides program. Gentiva Home Health offers this program to seniors to help improve balance and prevent falls. April Abele and Eric Wint with Gentiva Home Health are my guests on the Aging with Options show. We'll be back with much more right after this break. You're listening to Aging with Options on 970 WGTK.